Good morning. I'm Carlton Sharp, pastor of Faith Christian Center Church, right here in Beaumont, Texas. And I want to thank you for joining us on what's happening in our neighborhood. And I am so excited about our guest today. We have the director of the health department, Miss Sherry Ulmer. Welcome, Sherry.
Thank you. Thank you for having me.
So tell us a little bit about yourself and then tell us what you do.
Okay, well, I was born and raised in Beaumont, so I have just a committed investment in this community. So for the past 17 years, I have been working at the Beaumont Health Department, and I've been a registered nurse for over 40 years and absolutely knew nothing about public health until 17 years ago. I started off at the health department as the nurse manager, and then 5 years ago was promoted to the director's position. So public health has been so new and so challenging and so interesting for me to learn. Totally different from nursing that I did traditionally, nursing, but in nursing, we care for one patient at a time. That's our patient. We are developing care plans for that particular patient to get the patient to a point of wellness so that they can move out of the hospital. In public health,
the community is your patient.
The community is our patient. That's exactly right.
Yeah.
And so that was a bit of a change for me because I still want to do this hands-on, one-on-one thing, which I still get an opportunity to do, but not in the fashion that I was accustomed to. So when we look at the community being our patient, we look at those things that are affecting our community health-wise in a negative way.
Yeah. So tell us some of the things that you are involved in right now with the health department that's really affecting our community.
So right now we have a lot of chronic diseases here, like obesity and hypertension, cardiovascular disease, diabetes. So we were fortunate enough last year to receive a grant from Health and Human Services to address the issue of diabetes because obesity goes along with diabetes, diabetes goes along with obesity. And so we have a program now that we have tailor-made to address diabetes in Beaumont. First of all, being born and raised in Beaumont, we like to eat.
We like to eat, Sherry. Don't tell me we can't eat. Oh, don't tell me that.
Well, we can eat. We can eat, and I, whenever I'm going out and talking about addressing this issue, I always say I was born and raised in Beaumont by way of Washington, Louisiana.
Yeah.
So my parents were from Washington, and so we eat smothered foods, and we eat rice. I grew up on rice every day.
Yeah.
And we like fried foods, and so of course all of those things are not good for us.
We all gonna have to change.
We're gonna have to change, but my way of teaching is we can only make small changes at a time. So we know that we have about a 30% rate of diabetes. No, we have a 14% rate of diabetes, which is higher than the state percentage.
Okay.
And we have a 30% rate of obesity, which is higher than the state's percentage.
What programs are you doing now to help in this area?
So we go out and we actually do assessments. We will assess people, particularly African Americans and Hispanics.
Okay.
We will assess them for their risk for diabetes. So what we're trying to do is get them to understand that they are at risk and that they should begin to make some small changes now before they are diagnosed with diabetes.
So now you say you assess them. What type of assessment are you doing?
It is just a list of maybe about 8 questions.
Okay, a questionnaire.
It's a questionnaire, and it's nothing that's intrusive.
Okay.
And so as we get this information, we ask, we also take their weight, and we give them their BMI according to their height. And we ask about family history of diabetes, and we ask if they already have hypertension. And we ask if they exercise on a regular basis. And so if they score so many points or higher, then they are at risk for diabetes.
Now, you know, the Bible says that bodily exercise profit little, but it does profit us.
Yes, it does.
We need to exercise.
Yes, we do.
Yeah.
Yes, we do. So, you know, and starting off small, it's hard to tell people you need to have this exercise regime because they're not going to do it. That's just real big for them. But we're like, okay, if you're going out shopping, can you park farthest from the door and then walk into the grocery store, you know, that distance. Start with that. And then maybe you can start in your neighborhood. Just walk up the block and walk back. And then the next day, try to make it a little bit farther. So we understand that we have to gradually get people to do it. And if they look at small things that they can do and accomplish that, then they don't feel like they have failed the big picture.
So where can a person who may be watching today get this assessment? Can they get it online or?
They can come to the health department. No, we prefer to do it face to face.
Got you.
Because here's the other thing that we have found out. There are so many people who don't have primary care physicians. So either because they can't afford it, they don't have the insurance for it, and they think that they just are going to have to do without. Well, the only way that we can make this program work is if we partner with other agencies. So we have partnered with people like Legacy Healthcare Clinic, which is a federally qualified healthcare clinic, and people can go there and get primary care and be charged according to income if they don't have insurance. There are also people there who can help evaluate them to see if they qualify for the Affordable Care Act. So there's places that people can go. There is another clinic, UT Physicians, which is in the Gateway Shopping Center. It just opened in December. I mean, just opened their doors in December. And they are so busy. But they will actually, if we are doing our assessments and we find out that someone is at risk and does not have a primary care physician, we can call right then, and they will give them an appointment either that day or the next day.
Wow.
So we have really, we're so excited about the opportunities that we have to be able to offer people primary care. We have people who say, I didn't know. I wasn't aware. And so not only can they go there for their risk for diabetes, they can get medical care there. So it is amazing how we can change a person's life just in that instant, and they are so grateful.
So what other areas do you offer at the health department?
Well, at the health department, yes, we have a variety of services, and of course we have a brand new state-of-the-art building.
Yeah, I was going to get to that.
Yes.
Because I remember the white building on Washington Boulevard, the big old colonial building.
Beautiful house, beautiful old house, but of course it was not built or designed for what we do.
Yeah.
So now we have a state-of-the-art 30,000 square foot building.
Oh my goodness.
And it is absolutely gorgeous. I mean, the colors are soft, and when people first started coming after we opened, they would walk in and just go, everybody would get quiet and kind of be breathtaking. It's like, oh, it's beautiful. You got to come see it.
I will.
You got to come see it.
I will come see it.
So at the health department, we provide birth certificates and death certificates. Birth certificates if you were born in Texas. Death certificates if the family member passed away in Beaumont.
Okay.
So those are offered there. We have immunizations. We have a very, very active immunization program. And as a matter of fact, we're having a health fair on the 25th of this month from 10 to 2 at the health department. And it is encouraging people to keep their children on the immunization schedule. So,
wonderful.
And of course, you can come to the health department, and for most of the clinical services that we provide, well, all of the clinical services that we provide, we will not deny services due to inability to pay.
Okay.
So immunizations is a clinical service that we offer. We offer tuberculosis. So we actually still do have diagnoses of tuberculosis in Beaumont, and if someone is diagnosed, what we do is we contact all of their family members, and we do circles. We do the immediate family, and then we do where they work, where they go to school. Yes. And we will do TB skin tests. And if they are, if anybody tests positive, or the actual person who does have TB, we offer all of the treatment at no charge.
Wow.
We give them medications, and these people are probably on medications for about 6 months. So for the active TB person, we provide the chest x-ray. We charge $35 for it, or $40 for it. But if you don't have the $40, we will waive that fee.
Okay.
And then we provide the person with TB the medications, and we provide preventive medications to anybody who tests positive for TB. Doesn't mean that they have it, just means that they've been exposed to it.
Okay.
Their chest x-rays are normal, and we provide those medications at no charge too. So we have a medical director of our TB clinic who is just the TB expert of Southeast Texas, and so he's awesome to work with.
Now, I have seen a rise in sexually transmitted diseases in our area.
Absolutely.
I've taught a series on what I call the sex trap. You know, of course, God's plan is that a person will wait until they get married.
Absolutely.
But everybody is not living according to that plan.
Absolutely.
So what does the health department do? What services does it provide for those persons?
Yes. So you're absolutely right, Pastor. We have seen a rise in sexually transmitted infections, and we see that rise here in Beaumont.
Wow.
Just as it is in the state and as it is nationally. Those numbers are increasing. So we have a clinic where we will test a person who comes in for the 4 most common sexually transmitted diseases, which are gonorrhea, chlamydia, HIV, and syphilis. And we charge $20 only.
Okay.
And if they don't have $20, we will waive that fee. So we have totally, changed the way that we provide services, so people don't have to wait a very long time when they come in, because people's time is important. So they can come in, get tested, get education, so that hopefully we don't see them come back in the clinic again.
So is that an instant diagnosis once?
It is, for syphilis, it is instant, because we do have a rapid test for syphilis. For HIV, gonorrhea, and chlamydia, we do have to send those specimens to the state, and we usually get them back within a few days. But what we will do, if the person is symptomatic, we treat them according to the symptoms, especially for gonorrhea and for syphilis, if they are having symptoms. HIV, of course, usually there may not be any symptoms, or symptoms that they ignore, and we do send those off. And we usually get those results back within about 3 to 4 days, which is really, really good.
Are you seeing a rise in the youth population, or is it
Yes.
across the board?
Yes, well, there are more numbers in the youth population of teenagers, high school age, and college age.
Wow.
We're seeing, it's about the same numbers, but we're also seeing numbers in 45 and older in sexually transmitted diseases. 45 and older, which is a little bit new, but of course now we have drugs, like Viagra. The other thing that we have learned is that people are being in long-term marriages, maybe 20, 30 years, and their spouse passes away, or their spouse, or they get a divorce, and then they go into the dating scene.
Wow.
And so dating is not now what it was,
Back
30
then.
years ago, back then, when they got married. And so we're seeing a little bit of an increase in diseases with
So how do you,
age.
as the director of the health department, try to educate our entire community.
Yeah, we, so, you know, when they do come into our clinic, or we actually go out, we do some things at Lamar University. We do some things at the schools, and now going into the public schools, of course, it's a little bit, it's shaky.
Okay.
Because, you know, parents don't want to believe that their children are sexually active. And so a lot of coaches will ask us to come and talk to their groups of kids.
Okay.
And so it's getting a little bit better because we're seeing these numbers go up, as well as with HIV. Our HIV numbers are going up as well. So our standard education, the ABCs of sexual health, is A, if you're not married, then you need to abstain.
Abstain.
B, if you can't abstain, you need to be in a monogamous relationship. And you need to know each other's status. So we do have a lot of couples coming in to the health department getting tested. And they're not married, but they're in a monogamous relationship, and they come in and get tested to know, because everybody needs to know their status. And then C, if you can't do A or B, always use protection. You need to use protection if you don't know. So that's our standard ABC.
ABC.
Yes.
Okay, now tell us about the new facility. I know you mentioned on it earlier. Where is it located? And
Yes. It is at 3040 College Street, right next door to Baptist Hospital on their emergency room side. So, I mean, even our parking lot, we're so excited about it. The parking lot does not flood.
What'd you say, the parking lot?
Oh, I mean, we're just excited from beginning to end.
I remember going to the health department to get a birth certificate, and it rained, and the water was just up to my ankles.
Oh, you had to you were going to get wet. So we have the parking lot that the drainage is good. So, like I said before, it's 30,000 square feet. Most of our administrative services are upstairs on second floor. So administration is up there. Environmental health, which are sanitarians that go out and do the restaurant inspections,
okay,
they're upstairs. We have emergency preparedness. We'll talk about that in a minute. But emergency preparedness is upstairs. Health promotion is upstairs. So if anybody is asking for us to do a health fair or come to their church, maybe to do diabetes risk assessments, that occurs in that department. That's health promotion. We also have, we're responsible for the emergency medical service in Beaumont. So the 911 ambulance system is a part of public health.
Really?
So yes. And that's a 24/7 operation. And that's very busy.
So let's talk about the emergency. You said the
emergency preparedness. Yes. So that's one of our newest divisions in the health department. We received grant funds from the state after the events of 9/11.
Yes.
To be prepared to respond to emergency events like bioterrorism, smallpox, anthrax. And then to have plans in place to address those types of things, have plans in place to address hurricanes. So, you know, we do provide information on the emergency kits that you should have in your house on a regular basis. I mean, just on a regular basis, you know, we will lose electricity here all the time. Yeah. So there's a list of things that you can go to the City of Beaumont's emergency management website, and there's a list of things that you should have in the house as a part of an emergency kit. And we also encourage people, if the city issues an evacuation, please evacuate. If we have a pending hurricane heading this direction and the city issues an emergency evacuation, a lot of thought has gone into that. A lot of research and receiving information has gone into that. So we need people to evacuate for their safety. And once evacuated, we're asking people not to come back into the city until there's an all clear from the city. The city government, mayor and emergency management coordinator have to say it's okay for you to come back.
But all of that is housed right there in the new location?
Part of it
Part
is.
of it is.
Yes,
Yeah,
part of it
yeah.
is. Yeah, the teaching, I think, of the dissemination of information to the community is a lot of what we do. Yes.
That is so exciting to hear.
It is
all-
exciting.
All the good things that are happening at the health department.
It
you know.
is. It is very exciting.
And many people don't even know,
I have no idea.
you know, about all of the services that are provided there.
They don't. They have no idea.
And that's why we wanted to bring you on today to
I'm so
share with
excited.
us about some of the things that are happening.
Yes, I'm so excited because when people hear what we do, everybody says, we didn't know that you did that. And we're like, yes, we did. We do that. We do that.
Well,
So,
now they will know.
absolutely.
So I want to thank Sherry for coming today and sharing with us all the good services that are happening over at the Beaumont Health Department. It's a new location, and it's right there on the screen. The address is right there listed on the screen. And so take advantage of what is available to us in our city. Amen. So thank you for joining us today on what's happening in our neighborhood, and we will see you next time on our broadcast.